This is One-on-One. Larry Downs is the Chief Executive Officer of the Medical Society of New Jersey. Good to see you, Larry.
Good to be here, Steve.
We often have you on our sister program, Capitol Report, talking public policy, but we're going to shift gears a little bit on One-on-One. The Affordable Care Act, so many different pieces to it. You wanted to come in and talk about the Medicaid eligibility piece, but it's got a physician side. What are we talking about? It sounds complex to me.
Yeah, I think that it's a good thing that the state has expanded eligibility in Medicaid.
What does that mean?
It gets more people in different income brackets eligible for insurance.
Now, Medicaid, not Medicare. Medicare is for those who are elderly.
Over 65.
Medicaid is for those who financially qualify.
Yes, at lower levels of, at percentages of poverty.
Okay, so it's been expanded.
It's been expanded to include more people in income brackets that are higher than traditionally.
Okay, so where are the physicians for this?
It's a terrific concept. The problem here in New Jersey is that our program has been underfunded by various administrations for decades, and it's created a culture among physicians that they would rather provide care for free than to participate in the Medicaid program. It is probably one or two in the lowest paying Medicaid programs in the country.
Explain that. Patient comes in, now newly eligible based on the expanded Medicaid eligibility. Patient comes in. One of your doctors says, I want to treat you, but what?
It comes before that, Steve. When you try to find a physician, you'll have limited choices because very few numbers of physicians will accept Medicaid as a participating physician. So there's more in the primary care world, but primary care physicians sometimes have difficulty referring complicated patients out to specialists, and specialists routinely do not participate in the program because it simply pays too low of a fee to maintain a financially viable practice. And that is a significant issue that the state needs to address.
Okay, you say, quote, the state needs to address it. Translate that in terms of action.
Well, the ACA provided
the Affordable Care Act, otherwise known as Obamacare.
Federal legislation that expanded our insurance options actually had a provision in it that allows Medicare rates to be paid to Medicaid doctors for the first 2 years of the program. Medicare pays substantially more than Medicaid in the state. Okay, so we've raised the Medicaid rates to Medicare for 2 years. That expires this year. So we have to make some decisions about how we're going to continue to fund that expanded rate so that we have enough physicians in the Medicaid program to handle the expanded number of people who have enrolled in it.
Who has to vote on this? How does it happen?
I think it happens through the budget process. It can happen through a number of different mechanisms, but the fact remains that we need to invest in this program if we're going to expand it, and it's going to be a viable healthcare solution.
If it doesn't happen, what happens? Translate that for those who, in fact, are Medicaid eligible, who need health care, and if they don't get it, they wind up back in the emergency room.
But here's the hard part, yes.
Which is the whole idea of how we started this. We didn't want them in the emergency room because it drives up cost, and so-called charity care cases, the rest of us pay.
People will continue to get their health care when they need it. They just won't be at the right site for the care. They'll go to the emergency room, which is a high-cost environment, instead of getting it in a doctor's office. So
and they're waiting too long to get it.
And Steve, we're hearing from people in federally qualified health centers, which provide primary care in inner cities, that referrals to specialty care can take months. And when I tell my doctors about that,
what does that mean? Translate that. You see a primary care physician, he or she says, you need to see a specialist.
So I come to the primary care doc with an eye problem. You need a referral to an ophthalmologist because I'm not qualified to handle your glaucoma or whatever the issue may be. The time to the appointment for the specialist can be months or weeks, at which time the condition exacerbates. Maybe you
What's happening to your eyes? Getting worse?
It's getting worse, the condition's exacerbating, and then you go get care at an emergency room because you haven't been able to meet your appointment. We need to have a better and more thoughtful discussion in the state about how we're going to care for the poor and how we're going to create solid networks of both primary care doctors and specialists so everyone has access to care going forward.
But here's the thing, Larry, you and I have had this conversation for years about healthcare, well over a decade, but since the advent of Obamacare, it often seems that so much of the discussion and the debate is about it's the worst thing in the world, or It's really very good, but the rollout's been tough. It's been a little complicated. The president didn't exactly say it the way it is when he said, if you like your care, if you like your doctor, you keep your doctor. But to get these two polar opposites, right, positions, mostly on cable television late at night, you know the channels I'm talking about. Here on public television, that's not the discussion. Here's my point. What is the average person supposed to do who wants to get their eye taken care of? Because those discussions don't help them.
Well, I think
you know what I'm talking about.
On the ACA rollout, I think whenever you have a huge system like the healthcare system in New Jersey or any state or the country, and you make massive changes to it, we can expect some problems.
Right.
Thankfully, the physician-patient relationship is not through a website. It's a human interaction, and things will get taken care of.
Do you believe the basic doctor-patient relationship will change dramatically on the negative side because of the implementation of Obamacare?
I hope not. It is the backbone of the U.S. healthcare system. I think that physicians and patients will always have a relationship. I just hope that the insurance models that are built around financing the care have to understand that patients and doctors get to know each other over a course of years, and the care gets better and cheaper and better when you have regular care with the same provider, or the same provider team. So I think it'll change a little bit in terms of we're developing more team-based care models.
What was that, a team-based model?
Well,
I want to see my doctor. Why do I have to see a team?
We talked a little bit about the physician shortage. You mentioned it in your opening comments. By most accounts, there will be some kind of a shortage. I think some of the assumptions that some of the shortages are projected on are faulty. I think they think about me and you, doctor-patient, this is the interaction, and we're not going to have doctors have this kind of interaction. I think they fail to take into account that physicians, nurses, medical assistants, other will work in a physician-led team in the future and be able to expand care. It's not that a physician has to do every single task, but a physician needs to lead the team so that a patient coming into a care team, if they need access to a physician, they get it. No matter what your station in life, no matter who your insurer is, you get access to a physician. That's the key part of the
Larry Downs is the CEO of the Medical Society of New Jersey. Next time you come back on Capitol Report, you'll talk to us about how we're going to try to close the gap on the physician side, on the primary care physicians. Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by activists in cooperation with the American Medicine Chest Challenge, Choose New Jersey, NJIT, Health Republic Insurance of New Jersey, the New Jersey Education Association, Berkeley College, and by the Healthcare Foundation of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.